June 19, 1944, Normandy. The explosion that took Hans Meyer's freedom came at 0400 hours, 3 miles inland from Omaha Beach. He'd been operating in a field hospital, really just a barn with blood-soaked hay and screaming, when the American artillery found them. The blast threw him 12 feet. When he woke, his surgical instruments were scattered in the mud, and American soldiers with rifles stood over him. Dr. Hans Friedrich Meyer, 42 years old, Wehrmacht Medical Corps, captured. He expected execution. He'd heard the stories, what happened to German doctors, especially those who'd worked the Eastern Front. Instead, they put him on a truck, then a ship, then another truck. The journey took 3 weeks, and through it all, Hans carried one truth like a stone in his chest. Germany was superior. Germany was winning. These Americans, with their Hollywood smiles and chewing gum, were improvising, barely holding on. The propaganda had been clear. America was soft, decadent. They had jazz and movie stars, but not discipline, not science, not the ruthless efficiency that won wars. Hans believed this. He had to. The alternative was unthinkable. Camp Mexia, Texas, July 7, 1944. The heat hit him like a physical thing when they opened the transport truck. 103 degrees. The air tasted like dust and diesel. Hans squinted at the camp. Rows of barracks, guard towers, barbed wire catching the brutal sun. Familiar architecture of captivity. But something was wrong. The prisoners in the yard weren't emaciated, they weren't hollow-eyed. A group of German POWs were playing football, actual football with a real leather ball, and laughing. Laughing. One man waved at the new arrivals. He looked healthy, well-fed. Meyer, Hans F. An American lieutenant checked his clipboard. Says here you're a surgeon, thoracic specialty. Yeah, yes. Good, you're being assigned to the base hospital. 600 yards that way. The lieutenant pointed. Report at 0600 tomorrow. You'll be working under Dr. Benjamin Lewis. He's expecting you. Hans stared. Working. That's right. We've got wounded coming in, ours and yours. We need hands. You'll assist in surgery, follow American protocols, and, the lieutenant's voice hardened slightly, you'll do exactly what Dr. Lewis tells you. Clear. I? Yes, clear. That night, lying on a surprisingly clean bunk with an actual mattress, Hans couldn't sleep. Working. They were going to let him practice medicine on American soldiers. It made no sense. This had to be some elaborate psychological operation. They'd give him hope, then he forced the thought away. Tomorrow. He'd understand tomorrow. 0545. Hans stood outside the hospital building, a converted warehouse with a red cross painted on the roof. His surgical training screamed at him to be early. Old habits. Dr. Benjamin Lewis was already there. Mid-50s, gray at the temples, tired eyes that had seen too much. He looked Hans up and down, then extended his hand. Dr. Meyer, Ben Lewis, Hopkins Medical, class of 23. You. Heidelberg, 1927. Good school. Lewis's handshake was firm, professional. Let's be clear. I don't care what uniform you wore. In my operating room, you're a doctor. You follow my protocols, you don't improvise, and you treat every patient, American or German, with the same standard of care. That's not negotiable. I understand. Good. Let's go. The hospital smelled like every hospital Hans had ever known. Antiseptic, blood, fear, hope. But it was organized, clean. The floors actually shone. In Germany, by 44, they'd been operating in basements with flickering lights and prayers. Lewis led him through the main ward. 40 beds, 20 occupied. Each patient had clean sheets, clean bandages. An American nurse was checking vitals, marking a chart, moving with practiced efficiency. Then Lewis opened the supply room, and Hans's world stopped. The shelves were full, not rationed, not desperate, full. Surgical gloves in boxes, morphine, sulfa drugs, plasma for transfusions, sterile sutures, and there, On the second shelf, penicillin, dozens of vials, just sitting there. Hans's breath caught, his vision tunneled. In his last hospital in Germany, the underground facility outside Caen, they'd had 3 vials of penicillin for 270 men. 3. They'd decided who lived and who died, based on rank and utility. A lieutenant got penicillin, an enlisted man got prayer. He'd held Corporal Brecht's hand and lied to him. "You'll be fine. It's just a small infection." And then he'd watch the boy die over 3 agonizing days because they didn't have penicillin. Something wrong. Louis was watching him. Hans realized he'd been staring. His hands were trembling. The penicillin. How much do you have?" "In this facility. About 400 doses in current stock. Why?" 400? 400. "In Germany," Hans's voice cracked. He stopped, tried again. "We had 3 vials for 270 men. I watched 17 die of infections that penicillin would have cured." Louis's expression softened. Not pity. Something else. Understanding, maybe. "Yeah, we heard the supply situation was bad over there. That's war. Nobody wins when soldiers die of infections." He said it so casually, like it was obvious, like medicine transcended sides. And if this was just about the medicine, you might wonder, would that have been enough to change everything Hans believed? But the real shock was still coming. 2 days later, Hans was assigned to assist Louis in surgery. The patient was Sergeant Michael Torres, 23 years old, 51st Infantry Division. A German mortar had caught his squad outside St. Lo. Torres had taken shrapnel in his left leg, femoral region, major vascular damage, compound fracture of the femur. In Germany, with this injury, amputation, immediate, no discussion. You saved what you could and got the soldier off the table fast because 3 more were waiting. Hans scrubbed in, expecting exactly that. Quick amputation, cauterize, close, move on. Instead, Louis spent 6 hours reconstructing the leg. 6 hours. Hans watched, barely breathing, as Louis painstakingly debrided the wound, removed every fragment of shrapnel, repaired the femoral artery with sutures so fine Hans had to squint to see them, set the bone with a steel plate and 6 screws, closed the muscle layers separately, meticulously. "Suction," Louis said calmly. "More." "Good. See that bleeder? Second forceps. Tie it off." Hans did. His hands moved automatically, but his mind was reeling. This kind of surgery, this level of care, this was for generals, for officers, not enlisted men. "Penicillin," Louis said to the nurse. 70 units will hit it hard for the first 48 hours. 70 units, for 1 patient, for 1 leg. Hans had used 3 units total for 17 men. When they finally closed, when Torres was wheeled to recovery with his leg still attached, still viable, Hans had to sit down. He was shaking again. Louis pulled off his surgical mask. "You all right? That surgery, 6 hours, for an enlisted man." "For a patient," Louis corrected. "Yeah, that's the goal. Save the leg if we can, save the life if we can't. Why? In Germany, we would have amputated immediately. We didn't have time, didn't have resources, didn't have—" Hans gestured helplessly at everything. "This." Louis was quiet for a moment. Then, "You know what I think the difference is, Meyer? It's not resources. Well, not just resources. It's philosophy. You were taught to think of soldiers as equipment. Break one part, replace it, keep the machine running. We try to remember they're people." "We tried," Hans started. "I'm not saying you didn't try. I'm saying the system didn't let you. And if you're as shocked as Hans was in that moment, hit that like button, because what he learned next would shake him even more deeply. Let's continue. 3 weeks into his assignment, Louis asked Hans to assist with a facial reconstruction. "Fair warning," Louis said as they walked to the surgical ward. "This one's rough. Lieutenant James Caldwell, P-51 pilot, got shot down over Brittany. Plane caught fire. He got out, but—" Louis trailed off. "You'll see." They entered the room, and Hans's stomach clenched. The man on the bed was wrapped in bandages from the neck up. Only his eyes were visible. They tracked Lewis and Hans as they approached. "Morning, Lieutenant," Lewis said. "This is Dr. Meyer. He's going to assist today. How are you feeling?" "Like hell, sir." The voice was muffled by bandages, but young, maybe 25. "But I appreciate the house call." Lewis smiled. "Let's take a look." Hans had seen burn victims. God, he'd seen hundreds. On the Eastern Front, tank crews, pilots, men caught in flamethrower attacks. In Germany, they'd wrap the wounds, give morphine, and hope. If the burns were severe enough, especially facial burns, they'd make the patient comfortable. That was the euphemism, make them comfortable, because facial reconstruction was experimental, agonizing, and usually unsuccessful. Lewis began unwrapping the bandages, layer by layer. The smell hit first. Burned flesh, even healing, has a distinctive smell that never fully goes away. Then the visual. The left side of Caldwell's face was gone. Not just burned, gone. The skin had melted away. The cheekbone was exposed. The jaw was visible. The ear was a charred stub. Hans had seen worse, but what he saw next made him forget how to breathe. Grafts, skin grafts, but not the rough, desperate patches he'd seen in Germany. These were precise, measured. The new skin, harvested from Caldwell's thigh and shoulder, had been cut and fitted with the precision of a tailor working with fine cloth. The edges were sutured with stitches so small they were almost invisible. The graft covered the exposed bone, followed the natural contours of the face, and was held in place with tube pedicles, Lewis said, noticing Hans's stare. "See these flaps here? We keep them attached to the donor site for blood supply while the graft takes at the recipient site. Takes about 3 months, but the success rate is significantly higher than free grafts." Hans couldn't speak. This was surgery as art, as sculpture, as resurrection. "This is Lieutenant Caldwell's third procedure," Lewis continued. "We've got 2 more planned. By the time we're done, he'll be able to blink, eat normally, and speak without pain. The scarring will be significant, but he'll have function. Function, not just survival. Function, dignity, a life." In Germany. Hans's voice was barely a whisper. "We couldn't do this." "No," Lewis said gently. "I imagine you couldn't." Hans began spending his breaks in the hospital's medical library. It wasn't large, 1 room, maybe 200 books and journals, but to Hans it was a cathedral. He pulled journals methodically. The American Journal of Surgery, Annals of Surgery, Plastic and Reconstructive Surgery. Article after article on techniques that were theoretical in Germany, experimental at best, but here they were standard practice. Split-thickness skin grafts, tube pedicles, vascular anastomosis for limb salvage, the use of penicillin in wound prophylaxis, blood typing and plasma transfusions, cardiac monitoring during surgery. One article stopped him cold. Long-term outcomes of limb salvage in combat casualties. The author had tracked 217 patients over 3 years. 81% retained functional use of the saved limb. 81%. In Germany, Hans had amputated because saving the limb was impossible. Here they saved the limb because amputation was unacceptable. Same injury, different philosophy, different outcome. He read late into the night, taking notes by flashlight in his barracks. He sketched surgical techniques. He wrote questions in the margins. He was learning medicine again, like he'd never left medical school. One evening, Dr. Lewis found him in the library. "Meyer, it's 2300 hours. Don't you sleep." "I'm reading about arterial repair techniques, Dr. Carell's work from 1912. We never had access to this level of detail." Lewis sat down across from him. "You know, when they told me I'd have a German POW surgeon assisting, I thought it'd be a disaster. Figured you'd be arrogant, resistant, or incompetent. And you're none of those things. You're a damn good surgeon who got handed a raw deal by a system that didn't value what you value." Hans closed the journal. "What do I value?" "The patient. I see it when you work. You care. Not about the flag or the politics, about the person on the table." It was true. Hans had never thought of it that way, but it was true. Can I ask you something? Louis leaned forward. Honestly, why'd you join the Wehrmacht? Hans was silent for a long moment. 1933, I was 31. I'd just finished my surgical residency. Jobs were scarce. The military offered security, training, equipment, I thought. He paused. I thought I'd help people, heal soldiers, save lives. And I did at first. But then the war came, and there were too many wounded, not enough supplies, and the priorities changed. It wasn't about healing anymore. It was about efficiency, processing, numbers. That's war? No. Hans shook his head. What you do here, 6 hours to save a leg, penicillin used freely, facial reconstruction for a pilot, that's also war. Same war, different values. Louis nodded slowly. We're not perfect. Don't misunderstand. We've got our own problems, our own shortcuts, our own ugly math. But yeah, we try. We try to remember that every patient was somebody's son, somebody's husband, somebody's father. August 23rd, 1944. 1,700 hours. Hans was in the post-op ward when the sirens went off. Not air raid sirens. Medical emergency sirens. A truck screeched to a halt outside. Medics jumped out, pulling a stretcher. Trauma incoming. GSW to the abdomen. BP dropping. Hans ran to the receiving bay. Louis was already there, pulling on gloves. The patient on the stretcher was German. Hans saw the uniform first, or what was left of it. Feldwebel, sergeant, maybe 30 years old. He'd been shot in a training accident at the POW camp. Friendly fire, they said. An American Guard's rifle had discharged. The sergeant was gray. Shock. Massive internal bleeding. Get him to OR2, Louis barked. Meyer, you're with me. Let's move. They ran. In surgery, Louis worked with the same intensity he'd shown with every patient. But this time, Hans was watching differently. This was a German soldier, the enemy, the man who'd been shooting at Americans weeks ago, and Louis was fighting to save him like he was fighting to save his own brother. Suction. More. I need to see. There. Splenic laceration. Major vessel involvement. Clamp now. Hans handed him the clamp. Their hands moved in sync, a dance they'd practiced dozens of times now. The surgery took 4 hours. When it was done, when the bleeding was controlled and the abdomen was closed, the German sergeant had a chance. Maybe 70%, better than most. In the scrub room after, Hans asked the question that had been burning in his throat. Why? Louis looked at him. Why what? Why did you fight so hard? He's the enemy. He's German. 3 months ago, he might have killed American soldiers. Louis dried his hands carefully, deliberately. When he spoke, his voice was quiet. You want to know what I think? I think the moment that man became my patient, he stopped being German. He stopped being the enemy. He became a human being with a hole in his body that I knew how to fix. And if I started making choices about who deserves to live based on what flag they fought under, then I'm not a doctor anymore. I'm just another guy with a knife. He paused. Every patient I save, yours, mine, doesn't matter, is somebody who gets to go home. Maybe he'll be a good person. Maybe not. Maybe he'll tell his kids that Americans are monsters. Maybe he'll tell them we saved his life. I don't know. But I gave him the chance to make that choice. That's medicine. That's the job. Hans felt something break inside his chest, something that had been holding him together for years, the certainty, the propaganda, the comfortable lie that his side was righteous, his cause just, his suffering meaningful. We were told you were barbarians, he whispered. Yeah, Louis said. And what were you told about us using Jewish prisoners for experiments, about the camps, about... That's propaganda, Soviet lies. That's not... Louis pulled a folder from his locker. This came in yesterday, intelligence briefing. They're making us read it, all of us. They want us to understand what we're fighting against. He handed Hans a photograph. Hans looked, and couldn't look away. The photograph showed a pile of human bodies, hundreds, thousands maybe, skeletal, stacked like cordwood outside a building with a smokestack. The caption read, Auschwitz-Birkenau, liberated by Soviet forces, January 1945. There were more photographs, more camps, Dachau, Bergen-Belsen, Treblinka. This is Soviet propaganda, Hans said, but his voice had no conviction. Is it? Lewis asked quietly. And if you want to hear more stories like this, stories that official history forgot, subscribe now, because what happens next changed Hans Meyer forever. Let's continue. Hans didn't sleep for 3 days. He kept seeing the photographs, the bodies, the camps, the smoke. He told himself it wasn't real, couldn't be real. He'd served honorably. He'd saved lives. He wasn't part of that. But the doubt grew like an infection. On the 4th day, he asked Lewis for permission to speak with other German POWs, not from the camp, but from the hospital, men who'd been wounded, captured, treated. Lewis agreed. Hans talked to 23 German soldiers over the next week, carefully, quietly, and he asked the same question. Did you know? About the camps? About what was happening? The answers varied. Some said no, absolute denial, Soviet propaganda. Some said they'd heard rumors, whispers, but nothing concrete. 3 said yes, they knew. One had been stationed near Dachau. He'd seen the smoke, smelled it. We all knew, he said. We just didn't talk about it. Hans felt his world collapsing. Everything he'd believed about Germany, about the war, about his place in it, was built on a foundation of lies. He thought he was serving medicine, healing, but he'd been part of a machine that. He couldn't finish the thought. September 12th, 1944. Hans sat in the barracks with a piece of paper and a pencil. The Red Cross allowed prisoners to send letters home, censored, monitored, but allowed. He wrote, Dear Greta, I don't know if this letter will reach you. I don't know if you'll recognize the man who wrote it. I am alive. I am a prisoner in America. I am working in a hospital, practicing surgery under American doctors. I cannot tell you everything I've learned. They would censor it, and perhaps it's better if I say these things in person, if I ever see you again. But I must tell you this. I was wrong. About the war. About the enemy. About what we were fighting for. The Americans treat me with more humanity than I've seen from our own command. They treat our wounded soldiers with the same care they give their own. I've seen them spend resources, time, skill on men who were shooting at them weeks ago. I've seen what medicine can be when it's not rationed by ideology. And I've seen photographs of camps. Our camps. German camps. I won't describe what I saw. I can't. But Greta, if you've heard the rumors, if people are whispering about what's happening in the East, it's real. It's worse than the rumors. I don't know who I am anymore. I thought I was a doctor. I thought I was serving something good. I was blind. When this war ends, if I survive it, I will never practice medicine the same way. I will remember what I learned here. I will remember that every patient is a person, not a number. I will remember that healing transcends borders. I love you. I will come home if I can. Hans. He sealed the letter, gave it to the Red Cross officer, and wondered if Greta would understand, or if anyone would. November 9th, 1945. The war in Europe had been over for 6 months. Japan had surrendered in August. The world was trying to figure out how to be normal again. Hans stood in the supply room of the base hospital in Texas, looking at the shelf. The penicillin shelf. It was still full. Maybe more full than when he'd first seen it. Meyer, Lewis entered behind him. Your repatriation papers came through. You'll be on a transport back to Germany next week. Hans nodded. He'd known this was coming. You going back to medicine? Yes, if they'll let me. They'd be idiots not to. Lewis extended his hand. You're a hell of a surgeon, Hans. One of the best I've worked with. Hans shook his hand, held it. Thank you for everything. For treating me like a doctor, like a person. Lewis smiled. That's the point, isn't it? Before Hans left, Lewis gave him something, a medical textbook. Modern Surgical Techniques, published in 1944. Inside the cover, Lewis had written, "For Dr. Hans Meyer, may your hands heal without counting flags." BL. Hans returned to Germany in late November 1945. The country was in ruins, cities bombed to rubble, millions displaced. The camps had been liberated. The photographs were real. Everyone knew now. He found Greta in Hamburg. She'd survived the bombing. Their son had not. He'd been killed in the air raids of 43, 7 years old. They held each other and cried for hours. Eventually, they rebuilt. Hans found work in a hospital, mostly civilian now. The equipment was poor. Supplies were scarce. Penicillin was almost impossible to get. But Hans worked differently. He took his time with patients. He fought to save limbs. He reconstructed faces. He taught younger doctors the techniques he'd learned in Texas, the tube pedicles, the careful grafting, the patient approach. Some called him eccentric. Some called him slow. But his patients healed better, lived better. And slowly other doctors started asking questions, started learning. Hans kept the textbook Lewis had given him. He kept his notes. And sometimes late at night he'd open to a page and remember. He'd remember the supply room with its shelves of penicillin. He'd remember Dr. Lewis spending 6 hours to save a leg. He'd remember Lieutenant Caldwell's reconstructed face. He'd remember the choice, treating patients as people, not as flags. In 1952, Hans helped establish Germany's first dedicated plastic surgery unit. He trained 17 surgeons in modern reconstructive techniques. He advocated for better supply chains, better equipment, better care. He never forgot the box of penicillin. It had represented everything: abundance where he expected scarcity, humanity where he expected barbarism, possibility where he expected death. It had been the first crack in his certainty, and through that crack, light had entered. Hans Meyer died in 1983 at 81 years old. At his funeral, his former students, now some of Germany's leading surgeons, told stories of the man who taught them that medicine had no borders, that every patient deserved dignity, that healing was always worth the time. They didn't know about the box, but Hans did. He'd carried it with him for 38 years, not the physical box, but the memory. The moment when everything changed, when the impossible became real, when he learned that sometimes the greatest revelations come not from seeing new things, but from seeing the same things differently. The penicillin wasn't just medicine. It was proof that humanity could transcend hate, and that was the real cure all along.